I will be explaining about the fetal skull. The fetal skull is made up of ossified and incompressible base of the skull and the pliable vault or cranium, which is made up of tabular flat bones separated at the edges by sutures and fontanelles. The fontanelles and the sutures are bony landmarks. The bones of the skull are two frontal bones, the two parietal bones, and the occipital bone. Also, there are two temporal bones on either sides. The sutures are spaces between the cranial bones, which is occupied by membranes. The sagittal suture is a longitudinal midline suture which lies between two parietal bones. The frontal suture lies between the frontal bones in front of the anterior fontanelle. The coronal sutures separate the frontal from the parietal bones on either side. The lambdoid sutures separate the parietal bones from the tabular portion of the occipital bone. The sutures permit gliding movements of one bone over the other during molding of the head while it passes through the pelvis. Palpation of the sagittal suture with fingers during vaginal examination helps in determining the position of the fetus, the degree of internal rotation, and molding of the head. Fontanelles are the wide gaps in suture line and are the membrane-filled spaces at the meeting point of the sutures. There are 6 fontanelles, but only 2 of them, that is the anterior and the posterior fontanelle, are of practical importance. The anterior fontanelle, also known as the bregma, lies in the medial plane between two halves of the frontal and the two parietal bones, where 4 sutures, that is frontal, sagittal, and 2 coronal sutures meet. It is diamond shaped, being 3 into 2 cm in size, and ossifies by 1.5 years of age, that is at 18 months. The posterior fontanelle is triangular, 1.2 into 1.2 cm, at the junction of the sagittal suture with 2 lambdoid sutures. It is between the occipital and parietal bones. This closes at 6 to 8 weeks of age. The sagittal fontanelle may be present at the junction of anterior 2/3 and posterior 1/3 of sagittal suture, but has no clinical significance. Coming to the areas of the skull is divided into several zones or areas. The vertex is a quadrangular area bounded anteriorly by the bregma or anterior fontanelle and coronal sutures, posteriorly by the lambda or posterior fontanelle and the lambdoid sutures, and laterally by 2 parallel lines passing through the 2 parietal eminences. The sinciput or brow is an area bounded superiorly by the anterior fontanelle, that is the bregma, and coronal sutures, and inferiorly by the root of the nose and supraorbital ridges on either side. The root of the nose is also known as the glabella. The face is an area bounded superiorly by root of the nose and the supraorbital ridges, and inferiorly by the junction of the floor of the mouth with neck. The occiput is the area occupied by the occipital bone and is behind and below the posterior fontanelle. The parietal eminences are the 2 eminences on either side of each parietal bone. The diameters of the skull. Certain diameters of the fetal skull are important, and they give an idea of the size and shape of the fetal skull and the circumference. It may vary in different presentations according to the degree of flexion and extension of the head. So the transverse diameters of the fetal skull is the biparietal diameter, that is the distance between the 2 parietal eminences which is 9.5 centimeter. Super subparietal diameter is the distance between a point below one parietal eminence to a point placed above other parietal eminence on the opposite side. This is 8.5 centimeter. The bitemporal diameter is the distance between the lower ends of the coronal sutures at the temples. This is 8 centimeter. The bimastoid diameter is the distance between the tips of the mastoid processes, 7.5 centimeter. This diameter is incompressible and therefore it cannot be reduced even by destructive operations on the fetal skull. The anteroposterior diameters of the fetal skull are also of importance. The suboccipitobregmatic extends from the nape of the neck, suboccipital region to the center of the bregma, and it is 9.5 centimeter. This is the attitude of the head when the head is completely flexed. This diameter is the plane of engagement or the engaging diameter. The suboccipitofrontal extends from the nape of the neck to the anterior end of bregma or center of the frontal suture or sinciput. This is 10 centimeter and it is seen in incomplete flexion or slight deflexion. The occipitofrontal extends from the occipital protuberance to the root of the nose or glabella. This is seen in marked deflection and is 11.5 centimeter. The submentobregmatic extends from the angle between the neck and chin to the center of the bregma. This is seen when the head is in complete extension and is 9.5 centimeter. Submentovertical extends from the angle between the neck and chin to the center of the sagittal suture, 11.5 centimeter, and is seen in incomplete extension of the fetal head. The mentovertical diameter is the one which extends from the midpoint of the chin to the highest point on the sagittal suture. This is seen in partial extension of the fetal head and is 13.8 to 14 centimeter when the head is in brow presentation. So these are the diameters which are important. One should know and understand these diameters so as to understand the mechanism of labor in cephalic presentation when the vertex, brow or face is the presenting part. So with this we end the important parts of the fetal skull.